Miscarriages. Just the word itself brings about a lot of grief, confusion, stigma, and even isolation. Today, we are going to shed light on the struggles of recurrent miscarriages, their causes, and how we can treat it. Welcome to my channel. My name is Dr. Raisha, a pharmacist and a fertility and women's health expert. If you are new to this channel, please do not forget to subscribe and hit the notification bell down below. So, today we are going to look at recurrent miscarriages. This is a topic that is surrounded by a lot of silence and stigma. Let us break the silence and shed light on the struggles of many women struggling with recurrent miscarriages. We say that behind every statistic, there is a story. Maybe you have walked this journey, or maybe you know somebody who has walked this journey. So, today I want to enlighten you on some of the causes of recurrent miscarriages and how we can treat them. What are some of the causes of recurrent miscarriages? The first cause is genetics. Genetic predisposition. This is whereby you can find a woman has chromosomal abnormalities. I believe at one point in your life, you've heard about genetics, DNA, chromosomes. And so, a woman born with chromosomal abnormalities could be predisposed to recurrent pregnancy losses. Another cause is a disease or a syndrome that we call antiphospholipid syndrome, or the Hughes syndrome, or the anticoagulant syndrome. People with this syndrome usually produce antibodies that we call APL antibodies. These are autoimmune antibodies, antibodies that fight against the body's own cells. And these antibodies are linked to pregnancy losses. Another condition is the systemic lupus erythematosus. So this disease, we usually call it SLE. I don't know if you've heard about SLE, but SLE is also linked to the syndrome we've just talked about, the antiphospholipid syndrome, whereby now the body is producing APL antibodies, and hence these are linked to pregnancy losses. A disease such as diabetes mellitus could cause recurrent miscarriages. Also, if the person has bacterial infections, and so these infections can predispose one, can increase your risk of getting a miscarriage. This is very rare. It is very rare to find somebody with an infection getting a miscarriage, but it can occur. Another thing is the foods that you eat, the things that you consume, alcohol, tobacco, caffeine. Yes, caffeine can lead to miscarriage in some women. Another thing is a drug that we call isotretinoin. You could also know it by the name Accutane, Roaccutane. This drug is known mostly by the women with acne because at one point the doctor might have prescribed that drug for you. And so we usually say that this drug is associated with high risk of recurrent miscarriages. And so when women are put on this drug, they are also put on a contraception method. And women using this drug should not get pregnant, or women who are pregnant should not use this drug. Another thing is defects, anatomical defects. What do I mean by this? This is whereby you have maybe the uterus is not the normal uterus that we know. It has defects. We have when somebody can have half a uterus, we call it the uniconute uterus. We also have something like biconute uterus. And so when somebody has this, they could get recurrent miscarriages. And so we have seen some of the causes of recurrent miscarriages. So how do we go ahead and treat? How do we go ahead and deal with this condition? In this channel, we always say that before treating, we have to know the cause. We have to do some investigations. So the doctor could do investigations such as an MRI, an hysteroscopy, an HSG X-ray to find out what is causing. Because we just can't go and say you have recurrent miscarriage. No, we have to know what is causing this recurrent miscarriage. And so this is whereby now after the doctor has to identify the cause. So after identifying the cause, then they go ahead and treat it. So maybe if it is due to anatomical defects in the uterus, this could be corrected surgically. This is where now maybe the woman is, a surgery is performed to correct the defect. Another thing, if they have infection, we bring in antibiotics to treat the infection that could be causing these miscarriages. Another thing is maybe lifestyle modification. This woman is taking a lot of alcohol, she's smoking a lot. Then we advise her, she's cancelled on lifestyle modification, such as reduce your alcohol consumption, stop your alcohol consumption, stop smoking, reduce your caffeine consumption to prevent recurrent miscarriage. And so this is a journey that you cannot walk alone. This is a journey that you need to walk with your doctor so that the doctor can identify what is causing these miscarriages, and after that, devise a good plan for you. And there you have it, guys. That is our topic on recurrent miscarriages. If you like this video, please do not forget to give it a thumbs up. And if you have not subscribed, my dear, please subscribe and hit the notification bell down below.